Hi, my name is Tiffany Lee, and I am a second year neuroscience student. My research titled the Certified Learning Partner Program looks at establishing a partner placement model in long term care. With an aging population across the globe comes the growing need for long term care workers. However, nursing students often have negative preconceptions about long term care, resulting in a lacking interest and recognition of the industry's rewarding careers. To improve student learning and attitudes on long-term care, the project intended to find the best practices long-term care staff can use when training students. While there has been much research focused on helping students during clinical placements, there's limited knowledge on how to help staff. And so this was investigated through a joint partnership between the University of Calgary nursing faculty and staff at the Wentworth Manor long-term care home, serviced under the Brenda Strafford Foundation. By finding the best teaching practices, the objective was to create and introduce a workplace development initiative called the Certified Learning Partner Program, which aims to reinforce and recognize long-term care staff's knowledge and skills in guiding students during clinicals, formally certifying them as clinical care partners. I began my research by conducting a systematic literature review on long-term care staff's teaching practices and their effectiveness. Using the databases of Ovid Medline, CNOL, and Google Scholar, I searched the articles for what knowledge long-term care staff needed to know and the activities they needed to do or did well when working with students. My findings were narrowed down to 18 papers from 2008 to 2024, analyzed through a literature matrix. The literature findings were used to create interview questions revolving around staff experiences working with nursing students. 15 interviews were conducted by both my supervisor and I with Wentworth Manor's Director of Care, lead staff educator, healthcare aides, licensed practical nurses, and registered nurses. We then compared their responses to the literature. In our interviews, several themes appeared. First, the key teaching approaches used by long-term care staff was learning through observation. Other methods included encouraging questions, knowing student goals, and focusing on practical skills rather than theory. What staff said they needed to know when working with students included student course criteria, the current range of nursing skills, and their comfort levels. The key positive of working with students was the reduced workload, with secondary points including the sense of reward watching students' skill sets grow and students' ability to provide residents with company. Challenges working with students involve balancing time management and teaching pressures. Staff emphasized the slow work pace and generous amount of patience required to work with students. Lastly, for the implementation of the Certified Learning Partner Program, we found that the majority of long-term care staff's preferred learning methods were through verbal communication during work hours. During the interviews, we discovered that there were stark differences in the priorities of the managerial staff versus clinical staff. Managerial staff were eager to provide their input and learn how to improve student placements, while the clinical staff, whose focus was mainly on completing their work as quickly as possible, often had a hard time reflecting on their skill sets as they were seen as natural to them. As the clinical staff are the ones mentoring students, this could pose a challenge when implementing the Certified Learning Partner Program. Based on the staff interviews and literature review, we determined several recommendations for the program to enhance student learning. The program should educate staff using videos and infographics during 1-hour sessions between their shifts in adherence to their busy schedules. Small teaching tips should also be introduced about topics such as providing feedback, how to deal with mistakes, and recognizing moments for teaching. This would encourage the active review of individual staff's own skills and teaching methods. The next steps of this project is to implement a trial certified learning partner program during student clinicals in the winter 2025 semester. Future research aims to extend the program to sufficiently support a range of other students, including licensed practical nurses, healthcare aides, pharmacy students, as well as newly graduated employees and new hires. I'd like to thank my supervisor, Dr. Lorraine Venturato, for the wonderful opportunity and support in this research.